Why do we need to place a crown on a root canal treated tooth? Let's say there is a cavity here in the back tooth. The cavity is started in the enamel. Now this cavity is very small. This cavity has gone into the dentine. It just does not go just straight inside. It also spreads sideways. It means as the cavity is getting deeper, the cavity is also getting wider. It means a lot of tooth is being destroyed. So now we do a root canal treatment. We go into the roots and we do the treatment. But after treating the roots, we need to fill the top portion with a filling. Then we have to place a crown. Suppose if we don't place a crown, especially on the teeth which are used for chewing, this tooth can break very easily while chewing. Because while chewing, there are a lot of forces acting on the teeth. This crown is made of different materials. It can be made of metal, metal ceramic, or all ceramic materials. These are very strong. They don't break that easily. And once they sit on the tooth completely, then it does not break. In case of front teeth, let's say there was a blow to the front tooth. The tooth is not broken. But when you look at the tooth, all you see is the shape of the tooth is perfectly fine, except that the color is changed or it's giving some trouble. Now, these cases, we do root canal treatment, not from the front side, we do from the back side. So when we do from the back side and we complete the root canal and we can close that area where we started the root canal, so thereby the front side is not disturbed. So the front side, if the color is different or the color has become little yellow or little dark, then you can go for a veneer. You don't have to go for a crown. But if the tooth is broken, then usually you will need a crown. So the dentist will be the right person to decide for which teeth he would prefer to go for a crown and for which teeth he would prefer not to go for a crown.